Hello everyone, we're from SGD 9 and we're gonna be presenting about our student project with the title Ganglion Cyst. These are our group members. My name is Angel Faustin Chavez with the last 3 digit numbers 091. Okay, first of all, I'm going to explain about the background. Tumors of the hand are found 95 benign in the course of excluding a cutaneous malignancy. Representing about 60% of these benign tumors is the ganglion cyst. Ganglion cysts are synovial cysts filled with gelatinous mucoid material that are often found in clinical orthopedic practice. While the exact etiology of ganglion cyst formation is unclear, it is suspected that repeated microtrauma results in mucinous connective tissue degeneration. Problems occurring that ganglion cyst presentation can be varied and are determined by their location. Most generally, it happens on the dorsal side of the wrist with the percentage of 70%, followed by the flying side of the fingers, wrist, and tendon sheath. Apart from swelling, the bulk of ganglion cysts are asymptomatic. There are both non-operative and surgical therapies available, but non-surgical care has traditionally been afflicted by a high recurrence rate. Pharmacologic agents are still under continuous review. This may lead to a definitive medical treatment of ganglions, which would avoid surgery.
My name is Garrett as well as the digits of student number 077. So the formulation of the problems in its paper is what is ganglion cyst, how is the etiology of ganglion cyst, how is ganglion cyst epidemiology, how is the pathophysiology of ganglion cyst, what are the signs and symptoms of ganglion cyst, how to diagnose ganglion cyst, what is the differential diagnosis of ganglion cyst, how to treat or manage patients with ganglion cyst. Next, the purpose of this paper is to describe ganglion cyst, the etiology, epidemiology, pathophysiology of this disease. Also to describe the signs and symptoms of ganglion cyst and its differential diagnosis. This paper also explains about the treatment and management to treat patients with ganglion cyst. Next, there are 3 significance of this paper. The first one is for public's benefit, to make a better understanding of ganglion cyst and to make awareness about this disease. The second one is to the author of this paper, to give the author more experience of scientific writing and also to give a better understanding about this disease. The third one and last one is for the author institution, is to add more references to the institution, especially about ganglion cyst.
My name is Ana Agung Ayu Ratih Mira Putri, NIM 174, and now I will present the definition of ganglion cyst. It is a synovial cyst that formed by the capsule of joint or a seat of the tendon. This cyst contains mucoid ingredients soluble to jelly, which is rich in protein. There is no known exact etiology of ganglion cyst development, but it is believed that it is arise from microtrauma that is repetitive, leading to the generation of connective tissue. Included as soft tissue tumor, ganglion is often found in hands, knees, and feet. Generally adhere to the tendon sheath or joint capsule, but in some cases it is unrelated to any structure. The looks or the appearance of ganglion cyst varies depends on its development and its growth. Because of it is asymptomatic, patient commonly present with relief of pain or tenderness. Thank you.
Okay, first, my name is Gabriel with the number 169. I want to tell about the etiology of the ganglion cyst. The first theory, ganglion cyst, result of the herniation of the synovial tissue of the joint, and the another theory is the result of the chronic damage resulting in mucinous degeneration of the connective tissue. Ganglion cysts are also believed it arises from the mesenchymal cells as a result of accumulation of fibroblasts, which produce mucin due to repeated injury to the supporting capsule and the ligament structure.
Good morning, doctor. My name is Joseph Ngesiwe with the episode of 250. So today I'll be describing the epidemiology of ganglion cysts. So ganglion cysts are the most common soft tissue tumors of the hand and occur most frequently in the age group of 20 to 40 years, and women are more commonly affected. So they occur most frequently in the dorsal wrist, radial wrist, and the dorsum of the interphalangeal joint. 60 to 70% of the hand and wrist ganglion cysts are on the dorsal wrist, while 15 to 20% are located on the volar wrist. So ganglion in the adult population mostly originate from the wrist joint and rarely emerge from the sheath of the tendon, which are more affected in patients under 13 years. So it is presumably secondary to repeated trauma and wrist joint stress, which are seen often in gymnasts. Thank you.
Alright, so my name is Anagung Raprana Anantadiva. So now I'm going to explain it about the pathophysiology of ganglion cyst. Normally, joints and tendons are coated with a special fluid that locks in the small component. Sometimes, due to arthritis, injury, or for no apparent reason, a leak occurs and the component becomes thick like honey. And if this leak occurs it will flow out and cannot get back in, and will fill the space outside the whole area. When we use our hands to work, the joint will squeeze and put a lot of pressure on the fluid-filled components. And this can cause a lump with a lot of pressure so that it is hard as bone.
Hello, my name is Ferdinand with digit number 108. About the symptoms, ganglion cyst can include many symptoms like a soft bump or mass that changes size but doesn't move, swelling that may appear over time or suddenly, and also it may get smaller in size or even go away and come back. One large cyst or many smaller ones may develop, but they are usually connected by different tissue. Some degree of pain is possible, especially after acute or repetitive trauma, but many aren't painful. Pain caused by ganglion cyst may be chronic and get worse with joint movement. When the cyst is connected to a tendon, you may feel a sense of weakness in the affected finger.
My name is Sarah with 3-digit number 073. Now, there are many kinds of ganglions that exist, such as the first one is a dorsal wrist ganglion. It is a mass that can form on the hand in multiple places, most commonly on the back or upper side of the wrist or the dorsal wrist. It's usually the most common type of growth on the hand is the ganglion cyst, and frequently these cysts are harmless and not cancerous. The next one is the volar wrist ganglion. It sometimes occurs in the wrist near the radial artery. They can occur after a wrist trauma, which causes the joint fluid to escape because of the tear, and the body forms a thin membrane around the fluid, creating a ganglion cyst. And the third one is the volar retinacular ganglion. It's a type of tiny ganglion cyst located on the finger's palm or base. The lumps form around the wrist or hand tendons or joints. The size of a cyst will fluctuate as the joint is used for repetitive movement.
Hello doctor, my name is David Zatananda, student number 146. Cyst mucus, a mucus cyst, also known as a mucocele, is a swelling that occurs on the lip or mouth that is fluid-filled. When the mouth fluid salivary glands become blocked with mucus, the cyst forms. Carpometacarpal boss is a bone overgrowth with the carpal bones across the index or middle finger. Often the disease is called carpal bossing. A hard lump on the back of your wrist that doesn't move triggers this overgrowth. There are most people with carpal boss who have no signs. If it becomes uncomfortable or begins to restrict the range of motion in your wrist, the disease only requires care. Proximal joint ganglion interphalangeal, while trauma has been postulated as an initiating factor, the cause of this cyst is unknown. On the dorsal and palmar wrist, ganglion occurs most frequently. Nevertheless, proximal interphalangeal joints are rare.
Okay, first, my name is Gabriel, student number 169. Next, 7. Tender ganglion extensor. Ganglion cysts are thought to emerge internally from the mucoid degradation of the ground material of the tendon, creating cavities full of viscous fluid, or externally as a result of tenosynovitis infection of the tendon. And next is ulnar canal ganglion. Ulnar nerve compression in the canal of ganglion can result from repetitive blunt trauma, fracture of the hook of the hamate, and the aneurysm or arterial thrombosis. Furthermore, in the Guyon's canal, disorders such as ganglia, rheumatoid arthritis, and ulnar artery disease will easily compress the ulnar nerve. A ganglion cyst may protrude or develop acutely, which may also compress the ulnar nerve. And 9. Interosseous cyst ganglion. The interosseous ganglion is a gelatinous material containing cystic lesion that most commonly occur in the middle-aged patient, and is known to be similar to soft tissue ganglions. The etiology is uncertain, but attention has been given to the association with degenerative joint disease.
My name is Niman Putasari, NIM 125. I will explain about the diagnosis of ganglion cyst. So, from the clinical manifestation of ganglion cyst lesions is sufficient to confirm a diagnosis of ganglion cyst. So, history taking and physical examination are usually performed. Investigation in the form of MRI or ultrasound are indicated in this if the cyst is hidden or difficult to differentiate with a solid tumor. Meanwhile, radiographs or X-rays are performed to rule out the possibilities of bone involvement, for example, the intraosseous cyst. Biopsies of ganglion cysts are not regularly suggested. A mucin-filled synovial cell-lined sac without a genuine epithelial coating is a standard histopathological presentation. In most ganglion cysts, the dense mucinous substance present in extremely viscous due to high concentration of hyaluronic acid and mucopolysaccharides.
Number 25. So the different diagnosis of ganglion cyst for the dorsal first wrist ganglion is tenosynovitis, proximal pole of scapuloid, metacarpal bulbs, lymphoma. Next. And different diagnosis for volar wrist ganglion is tenosynovitis, carpal osteoarthritis, sarcoma, intraneural cyst. Next. And the different diagnosis for volar retinacular ganglion includes epidermoid, is giant cell tumor of tendon cyst, foreign body granuloma, lymphoma, and neuryloma. Next, the different diagnosis for mucocyst is Haberden nodes, gout, giant cell tumor of tendon cyst. Next, and the differential diagnosis for extensor tendon ganglion is giant cell tumor of tendon cyst, tenosynovitis, CMC bus. And the differential diagnosis of intraosseous ganglion cyst is simple bone cyst, osteoblastoma, and chondroblastoma.
My name is Komandisa, NIM number 98. The treatment and management for ganglion cysts are divided to conservative and surgical treatment. For conservative treatment, there are observation, immobilization, and aspiration. For the first line, observation. In ganglion cysts with no symptoms, ganglion cysts tend to disperse slowly. Asymptomatic patient will be given recommendation to reduce activity and observe until the cyst has shrunk. The second one is immobilization. To reduce the risk of pain and hemorrhagic ganglion cysts, patients are recommended to reduce activity of using the wrist or area affected by ganglion cysts. And the third one is aspiration. Aspiration method is carried out to remove fluid from inside the cyst by piercing the needle into the cyst. However, the rate of the recurrence of ganglion cysts after aspiration is greater because the cysts are not completely removed. The last one is surgical treatment. Surgical treatment is given when the cyst has a recurrence after aspiration or when the conservative treatment does not result in a good prognosis. Excision surgery can be done either by open surgery or arthroscopy, and it is performed on outpatient.
So, for conclusion of this topic, ganglion cysts are synovial cysts that form by the capsule of a joint cyst or seat of a tendon. Ganglion cysts are the result of herniation of the synovial tissue of the joint. It is also formed because of the repetitive wrist stress which exhausts the joint capsule. Ganglion cysts can affect all age groups, mostly people at age 20 to 40, and it affects women more by 3 times. The main complaint of ganglion cysts is the appearance of lumps with or without pain. The examination includes anamnesis, physical examination, and radiology examination. Differential diagnosis of ganglion cysts includes tenosynovitis, infection, carpal osteoarthritis, lymphoma, sarcoma, and etc. And the treatment choices for ganglion cysts are conservative, like observation, immobilization, aspiration, and surgical. That's all for our presentation today. Thank you for watching and see you next time.